My Cancer Genome is a publicly available tool created for clinicians by clinicians for genome-directed cancer treatment decision-making. Unlike hormone receptor positive and HER2 positive breast cancer, triple-negative breast cancer lacks targeted therapy options. Current therapies are limited to highly toxic chemotherapy. With the emergence of tumor gene mutation profiling in breast cancer, we have the opportunity to identify activating pathways in triple-negative breast cancer that may be targets for new therapies. Vanderbilt has undertaken tumor gene mutation testing for several genes in breast cancer. Here you see I am logged into Vanderbilt's electronic health record and reviewing the tumor gene mutation testing results for a mock patient. To learn more about the clinical significance of a particular mutation for this patient, I simply click on the mutation and am taken to My Cancer Genome, directly to that specific page for that particular mutation in the PIK3CA and specifically for breast cancer. Here I can learn more about the frequency of this mutation in PIK3CA mutant breast cancers and about various therapies that are under development for PIK3CA mutant breast cancer. In addition to a summary, I can link directly to the clinical literature, including the abstract in PubMed, to find more information. I can also search on clinical trials that are available for PIK3CA mutant breast cancers. Here I see the results at Vanderbilt first, since I linked directly from Vanderbilt's electronic health record. Had I linked from another institution's electronic health record, I would have seen their institution's clinical trials first. Should there not be a trial available at Vanderbilt, I can see clinical trials available throughout the United States and outside the United States, and get more information on the eligibility for that trial through clinicaltrials.gov. Not only is My Cancer Genome available directly from Vanderbilt's electronic health record, but it is also available to the public, freely available at www.mycancergenome.org. Here I can search for more information about cancer genes, and I can search on a particular disease, here breast cancer. I can find more information on particular genes. We cover 3 different genes at this time, including PIK3CA, and select a particular mutation. And just as I did at Vanderbilt, I can find more information on the clinical significance of that particular mutation. We've recently added a clinical trial search, which allows us to search for over 135 different cancer diagnoses and 443 cancer genes. For instance, if I search for breast cancer and BRCA1, I find several clinical trials that are evaluating the role of BRCA1 and 2 mutations in triple-negative breast cancer. I can filter these results by geographic location. Let's say I don't want to look at international trials. And within the United States, I can find a particular state, let's say my state of Tennessee. And here I get a much more filtered result set. Furthermore, I can filter clinical trials by phase. Let's say I only want to look at later phase 2 and phase 3 studies. In addition, I can search on even more rare mutations, such as BRAF mutations, which occur in approximately 2% of breast cancers. Here I find that there are several phase 1 studies that are evaluating the role of BRC mutations in solid tumors, for which triple-negative breast cancer patients would be eligible. Our goal is to continue to enhance the specificity of our annotation of biomarker eligibility criteria for breast cancer clinical trials, and to enhance our clinical trial search to take into account multiple simultaneous biomarker criteria, as is needed to account most accurately for a search for triple-negative breast cancer. We will continue to enhance our content regarding the various gene mutations in breast cancer, and with this, we hope to make genetically informed cancer medicine the next standard of care for breast cancer.